Hello, everyone. Welcome to the world of orthopedics. Today, we will learn CTEV. CTEV, that is congenital talipes equinus varus. Okay. Congenital means it is from birth. Talipes related to talus bone or foot. Equinus is the deformity, and varus is the deformity. We will learn one by one. This is the picture of CTEV, which is present in child. Next, introduction. CTEV is also known as club foot. Why? Because it resembles the shape of a club, that is, a golf bat. Okay, it is the most common congenital anomaly of leg, ankle, and foot. Okay, just see the shape of this foot and this golf club. These resembles, that's why it is known as club foot. Now, epidemiology. 50% of the cases are bilateral. We have seen in the photograph also that was bilateral. And it is present in 1 is to 1000 live births. It is more common in males. And the firstborn child are associated with fetal malpresentations like breech. Not all the child, but most of the child are firstborn males and they are associated with breech presentation. Okay. Now, etiopathogenesis. There are many hypotheses, but the most accepted one is the primary germ plus defect of thallus. There is hypoplastic thallus bone. Because of that, the talonavicular joint is dislocated, and this leads to unstable foot. And unstable foot leads to pull by the tendo Achilles and tibialis posterior. That's why foot is deformed. Foot appears to be pulled posteriorly and medial. This is the hypothesis. Now, next, classical deformities. What are the classical deformities? First of all, see it with the diagrams. First is cavus. This is the cavus. Means the medial arch is exaggerated. This one. This is the cavus deformity. Okay. And this is the adductus. Means it is more towards the medial side. Okay. Now this is the varus. Varus means this. Okay. This is varus and this is equinus. Means heels are not touching the ground. Here heels are touching the ground, but here heels are not touching the ground. Okay, this is Equinus. Now let's see it in theoretical format. Cavus is exaggeration of medial longitudinal arch. We have seen normal foot is like this. Okay, and cavus is like this. Okay, means medial longitudinal arch is like exaggerated. Okay. Adduction, it is at talonavicular or mid-tarsal joint. Okay. Normal foot of the child is like this. And CTEV foot is like this. Means like this. Okay. So this is adductus. Okay. Varus is at talocalcaneal or subtalar joint. Okay. Talocalcaneal or subtalar joint. And equinus is at ankle joint. Means foot is not and heel is not touching the ground. Foot is like this only. Okay. Now, sometimes internal rotation of tibia may also be seen. Okay. These are the deformities: cavus, adductus, varus, and equinus. Now let's move towards the association. Many of the cases are associated with meningomyelocele, which is the most common one. Other association is arthrogryposis, multiplex congenita, tibial hemimelia, lateral popliteal nerve palsy, poliomyelitis, and cerebral palsy. These are the association. We have to go through it only. We don't have to learn it. Okay. Now let's move towards the diagnosis. Most of the diagnoses are by inspection only, but there are tests. We can see this. First screening test is the dorsiflexion test. Whenever we dorsiflex foot of a child, means just example, this is the foot of a child. If we dorsiflex it, this point touches this point. Okay, means dorsum of foot touches the shin of the child. But in club foot, we can't dorsiflex the foot of the child. Means by active force also we can't touch dorsiflex it. Means this point doesn't touch this point of the foot. Okay. Now confirmatory test is the decreased kite's angle. There is an angle in the foot between talus and calcaneum. Okay. Here we can see in the diagram, this is the angle between talus and calcaneum. Normally this angle is 20 to 40 degrees, but in CTEV this angle decreases and it almost becomes parallel. Okay, so this is seen in CTEV. Now move towards the treatment. Treatment should begin as soon as possible after birth. There are many methods. Let's compare two methods, Ponseti's and White's method. In Ponseti method, we start the treatment in about 2 weeks. And in Kite's method, we start it in 1 month. Okay, here the order of correction is cavus, adduction, varus, then equinus. Here, adduction, inversion, and then equinus. Here, the fulcrum is the head of talus, and here it is calcaneo-cuboid joint. Okay, now we apply cast in these methods. So the POP cast, which is applied in Ponseti's method, is applied above the knee also, means above knee cast is applied. But in Kite's method, we apply below knee cast. Okay. Duration of treatment is 6 to 8 weeks in Ponseti's method and 6 to 9 months in Kite's method. Now let's see one by one, which is followed most of the time, is the Ponseti's method, where we manipulate the foot to correct the deformity. Order of manipulation is we have seen cavus, adduction, varus, and equinus. Okay, adduction and varus is corrected simultaneously, and then equinus. We maintain the manipulate the foot. We maintain the deformity by applying the POP cast. And in 6 to 8 weeks, all the deformities are corrected. Okay. We apply POP cast above the knee, keep it for 1 week, and repeat the procedure after 1 week. Every week, we used to change the cast and correct the deformity, and the treatment is completed in 6 to 8 weeks. Now, what is this rocker bottom foot? This is if we reverse the correction, order of correction. If it doesn't follow the CAVE, then the deformity is formed that is known as the rocker bottom foot. Okay, rocker bottom foot is due to two conditions. First is wrongly corrected CTEV. Second is congenital vertical talus, which is present in Edwards syndrome. Okay, so let's move towards the treatment duration wise. If the child comes from birth to 2 weeks, if the child comes within 2 weeks of birth, okay, then we advise manipulation by the mother only. Okay, if it comes between 2 to 8 weeks, then we advise Ponseti's method by orthopedician. Okay, if the child comes from 8 weeks to 5 years, then we advise posteromedial soft tissue release, which is also known as Turco's method. Okay, we have seen in the hypothesis na कि it is pulled by tendo Achilles and tibialis posterior due to which the deformity is formed. So here in this method, we lengthen tendons, tendo Achilles and tibialis posterior. Okay. Now, if the child comes from 5 to 10 years, then we will do Dilvian Evans procedure, which is the corrective osteotomy, will change the shape of talus or calcaneum and thus the deformity is corrected. And if the child comes from 10 years and above after 10 years, then the only method is triple arthrodesis, which is the artificial fusion of three joints. Which three joints? Subtalar, talonavicular, and calcaneocuboid. Okay, we have to learn this. Subtalar, talonavicular, and calcaneocuboid. Okay, now let's see the prevention of recurrence. We have treated the patient 8 weeks. Now we don't want to recur the condition. So that's why we use these two shoes. This is the Dennis Brown splint and this is the CTEV shoes. CTEV shoes, normal shoes are like this now. So in CTEV shoes, their inner border is straight and outer raise and there is no heel as compared to normal shoes. Okay. Now Dennis Brown splint. Till the baby learns to walk means, but the compliance is very poor because we have to apply it 24 hours only. And CTEV shoes is applied once the baby starts walking. Means 3 to 5 years of child is advised CTEV shoes. And while sleeping, use Dennis Brown splint only. And it should be worn at least 23 hours a day. Okay, CTEV shoes. And here we have completed the topic of CTEV. If there is any doubt or any topic is left uncovered, please let me know in the comment section. And if you have any doubt or you want the PDF or PPT of this class, you can mail me on the email address displayed. Thank you so much.